Hello students, we will discuss a common condition, a swelling today which we come across in surgical OP and ward. So identify it, what this condition is. Look at this, you can see the wrist, you can see the dorsum of the wrist, you can see the swelling here in front of the wrist in the hand. See what this condition is. Very common quantity. There are different. It's a differential diagnosis, of course. Only once we examine, will be able to tell proper clinical diagnosis. But at least we will have the intuition what this condition probably is. This is ganglion. So it is not anatomical ganglion like sympathetic ganglion, parasympathetic. It is not so. It's surgical ganglion. Okay, otherwise called the ganglion cyst. Terminology is ganglion cyst. Ganglion cyst terminology it is. And what are the features? Cystic swelling occurring with a tendon sheath or joint capsule is very important. So common in dorsum of the wrist here. Flexure it around ankle. Soft, smooth, fluctuant swelling on contraction of the wrist against resistance. Mobility restricts. When you do like that, mobility restricts. That's important test. Mobile in two direction. When you do like this, mobility restricted. This contraction against resistance, checking the mobility. After checking the mobility without contraction, that is the most important test for ganglion. What's the differential diagnosis? Lipoma, neurofibroma, bursa, sebaceous cyst. Remember, all these things are possible things. So treatment is excision under local anesthesia. It can be left alone if it is asymptomatic. Cosmesis is the problem. Sometimes it disappears on its own. Olden days, Bible, they used to put over the ganglion and press it so that it ruptures. So that ruptures and pressure by pressure, and that disappears. That's in olden days. Sometimes disappear, otherwise you have to do surgical excision. Under local anesthesia, you have to apply crepe bandage after that. So that is a ganglion, very commonly asked question. You can see that ganglion in front of the wrist also. Wrist is a very commonest site. The next common is the foot around the ankle. So this very commonly asked for a short note. Clinical care they will keep, oxy they will keep. So MCQ they will ask. So it's either to the joint capsule or synovial sheath of the tendon. So gel-like fluid is very common. So remember the differential diagnosis. The contraction test is very crucial to clinically differentiate it from other swelling. That is the important point you have to remember. So go through my clinical methods of examination, especially swelling examination. All these things will come off exactly examine ganglion and other swellings, and go through my surgical manual, current edition or 7th edition, which gives a detailed explanation of everything with illustrations and photos. My operative procedure, even small procedure to big one, shows properly. 2-volume book, how to suture, how to approximate it. At last you can go through that. My digital lectures, A to Z, UG, CABM, even for PGs, covers basic specialties, operative surgery, instrument X-rays and so on. So you can subscribe for a year and have a clear idea about the surgical topics and exam, understanding, academic, everything. So students, I hope you understood ganglion very well. Thank you very much.